Hi, everyone. Tuberculosis, or in short, TB, is the second leading cause of death worldwide from an infectious disease after COVID-19. In 2021 alone, more than 10 million people fell ill with tuberculosis. And in Peru, it has the highest TB rates in Latin America. What does this mean? It's important to address this issue. For my research, I was particularly interested in learning about how adolescents experience TB treatment. This is important because adolescents are often overlooked in research because they're either categorized as adults or children despite their unique experiences and needs. Now, take 5 seconds to remember when you were an adolescent. And then imagine having to go to treatment for 6 months and having to go to school, to work, or partake in social activities. Sounds quite challenging, right? Well, before I dive deeper into what my research consisted of, I want to briefly explain what tuberculosis is. It's an infectious disease that infects the lungs and is spread through the air from one person to another. But TB is treatable and preventable. For my research, I was able to have access to 85 qualitative interviews that were conducted in Spanish in Lima, Peru. The Lima metropolitan area accounts for more than 50% of all TB cases in the country, so this data was extremely valuable. The interviews consisted of 3 key informant groups: adolescent patients, their caregivers, and their healthcare providers. And through qualitative data, I was able to have a narrative of in-depth experiences of what it's like to undergo tuberculosis treatment in Peru. To organize my findings, I was able to utilize a framework that was developed by the World Health Organization on adolescent-friendly services. And then I applied it to TB treatment. This framework consists of 5 dimensions of care, which are equity, accessibility, acceptability, appropriateness, and effectiveness. Then I was able to analyze how Lima met or did not meet the criteria from this guideline. And some key findings that I was able to find with my research was that unfortunately, TB services are not completely free of charge, despite there being a law in Peru that states otherwise. Some participants commented that they had to go to private health centers to get their x-rays or other tests to continue treatment because the public health center did not have the adequate machines to run these tests. So ensuring that these public centers have the machines, it would be a way to address this issue. Another problem is that adolescents are facing discrimination and stigma at their schools. And this is because some of the staff and students are not really aware or understanding of what it's like to undergo tuberculosis treatment. So a potential solution for this is introducing workshops, educating staff and students about what it's like to have tuberculosis, so then we can decrease stigma and discrimination, and then hopefully adolescents can continue their treatment without having a lot of barriers. And lastly, updating some guidelines for TB in Peru, such as providing more alternatives such as video recording of medication intake, more flexible service hours, updating the isolation period from 2 months to 2 weeks, and increasing the access to nutritional and psychological services can potentially improve treatment outcomes. In the end, this research matters because it's inclusive of adolescents' input into care that is being delivered for them. And hopefully with these findings, we can improve treatment outcomes in Peru and globally as well. Thank you so much.